Again, we need a circle of care. It's just as important to develop a circle of care to help one another with preventive health habits and to enjoy pursuing them together. For instance, residents of the beach cities in Southern California were found in a study to be suffering from especially low well-being and high stress. Working-class residents with full jobs and long commutes weren't making use of their healthy environment. So the cities partnered to launch a 3-year program called Vitality City that would get people moving and eating better. They offered walking moyas. It's a term that comes from Okinawa. It means walking groups. But they're about more than just walking. They're about social connection with a circle of caring neighbors. At the first walking moya last spring, the mayor expected about 200 people, not for about 10 walking groups. 1,000 people showed up. They formed 100 walking groups. And then restaurants were rewarded for offering healthy choices after the walks. People who joined have developed a strong sense of community, and this idea is going to percolate around the country. We need to remind each other that if we don't take good care of ourselves in our 40s and 50s, we won't be able to enjoy the bonus years after 60. And you know, the largest demographic group in America today is women aged 45 to 55. These are the prime years for a midlife passage. But the majority of women in that passage today, between 45 and 55, are less happy and more stressed and showing poorer health than previous generations of women at the same stage of life. These are not the women who are having lunch to grouse about why women can't have it all. These are women who are worried they may lose it all. They may be working 2.5 jobs to put their kids through college and at the same time acting as caregivers for their aging parents or in-laws. So worry, sadness, depression are emotional health problems that are reported by more than 20% of these women in midlife. And 1 in 4 women aged 45 to 59 are taking antidepressants. Well, one antidote proven in studies to be helpful is attending faith-based services regularly, feeling part of a larger group with a shared faith. It can add years to life expectancy. And of course, being in a positive, committed relationship can also add bonus years. So one of the things studies say is, stick with your partner after 60. You'll appreciate it, and so will he or she. The happiest women in midlife years have college and often postgraduate educations, or they've gone back to school to upgrade their skills and their whole knowledge base. They have good jobs, a short commute, or the flexibility to work some days at home. They gain emotional nourishment from an intact marriage, and with a dual family income of $120,000 and up, they have the financial resources to live in a safe community with easy access to places to walk. And they exercise regularly, outdoors, indoors, or when it's raining, even on a bike in the garage. But here's the kicker, as I said before, by their early 50s, these happiest of all women in midlife have no children left at home, and they, at present, have no family member yet who needs caregiving. Men 45 to 55 were the worst hit during the early part of our stubborn recession. Many were thrown off the escalator of advancement in favor of younger men and women who have grown up online with fingers that talk for them. Many of these men are now learning to reinvent themselves as entrepreneurs. They may need to use some of the extra 30 years here to go back for education and learn new skills to qualify for the digitalized world of jobs. They may start their own small business, maybe partnering with a son or a nephew or a daughter or an old college buddy. Others are bailing out of corporate life before they're involuntarily retired, which happens starting around 55. And maybe some or others are trying out an artistic career that can be home-based and more meaningful. But this usually depends on a care circle close to home, a wife who can take over as prime breadwinner for a time. I'm sure as health professionals, you're frustrated by men's resistance to preventive health practices. You know, men tend to be reactive rather than proactive in responding to the earliest body alert. Some time ago, I distributed a well-being questionnaire to male members of the American Bar Association. The subjects were divided by age to compare men 40 to 49 with their counterparts who were 50 to 59. They were mostly all type A's. What stood out in the results was the younger group had more health and well-being complaints than their older counterparts, a decade older. And the reason came out in my follow-up interviews. The older men who felt better had a body alert at some point in their 40s. They were diagnosed with dangerously high blood pressure or the beginning of degenerative discs, and they'd focused their hard-driving energy on getting stronger and healthier. And on their checkoff lists, they were healthier and less anxious than their counterparts 10 years younger. I recently heard the head of psychiatry at Stanford say that one of the best things a man can do for his health as he ages is to be married to a supportive woman. No surprise there. The same psychiatrist said the best thing a woman can do for her health as she ages is to nurture her relationships with girlfriends. But this very august psychiatrist pulled out scientific evidence that the quality girlfriend time actually does help us to create more serotonin. And of course, that's the neurotransmitter that helps combat depression and generates a feeling of well-being. And he said, spending time with a girlfriend is just as important to our health as jogging or working out at a gym. So the next time you skip the gym to schmooze with a girlfriend, just know you're doing something really good for yourself and her. Today, there's more age anxiety than ever. Now, why is that? You know, middle-agers have never been more powerful, more productive, more alluring. But on the other hand, boomers themselves, as anti-aging marketers, have been making midlife look thinner, sexier, happier, hipper, and much, much younger. So in the dark of morning, when you don't get up in time for fitness class, does a nagging voice whisper, "You'll never be as thin as Jane Fonda. You'll never have as much hair as Richard Gere"? Well, don't worry, just wait. When you're older, you'll get over it. 50 is the infancy of what I call our second adulthood. We really have time to start all over again. What do you want to do? What do you want to be? What is your passion in life? When will you qualify as old? Now, I wonder myself. I mean, imagine how I feel when I wake up and I find this 75-year-old woman sleeping in my bed. I like to call the stage the stage we enter at 75, ready for your next to last dog. Dustin Hoffman is now 75, and I heard him say he figures that since dogs live an average of 10 to 12 years, he has 2 to go. Now that's preventive thinking. In a national survey of boomers asking when you will be old, the average they came up with was 79. So we've expanded the landscape of the middle years from 40 to 80, a whole second half of life. The age of Social Security in the US, 65, is a meaningless number. That law was passed back in 1935 when life expectancy for Americans was 61. Today, for American men who reach age 65, life expectancy is 83. For women, it's 85. And 1 out of every 4 Americans who reach 65 today will live past 90. But we face 2 great healthcare emergencies in the first half of the 21st century. The first is the caregiving crisis, and the second is the epidemic of Alzheimer's disease. Family caregiving, and especially long-term care, has become a predictable crisis for Americans in midlife. I know I started taking care of my husband when he first had cancer, and I cared for him through 3 battles with cancer over the course of 17 years. It was the toughest thing I've ever done. Our initiation usually starts with the call. It's a call about a fall or a cardiac arrest, or the call is about your dad. He's run a red light and he's hit somebody, but he doesn't quite remember how it happened. Is it his eyes or is it his mind? You don't really want to know because you know you're not going to win the argument over the car keys. You listen to conflicting advice from friends. You consult with different doctors who offer different opinions. If surgery is needed, you try to find out how many times that hospital has done that procedure. It's very, very difficult to find out.